Hi, my name is Rute and I'm a medical doctor. Thank you so much for tuning in into this video. Today we're going to talk about high blood pressure. More specifically, we're going to look at what is high blood pressure, why do we worry about high blood pressure, what are the numbers that indicate that you have high blood pressure, what are some of the symptoms that you can get with high blood pressure, and how do we treat it? Now, high blood pressure is quite a huge topic, so I'm going to do a number of videos just talking about different aspects of high blood pressure, including medication, some of the side effects. So if you haven't subscribed to the channel, please do and press the notification bell so that you're notified every time I post a video. And if you've already subscribed, thank you so much. I hope that you're finding these videos useful. So let's get into the video. Firstly, what is high blood pressure? So high blood pressure is medically known as hypertension. We measure your blood pressure using a blood pressure machine that gives us two numbers. These numbers will be one number over another number. The top number is called the systolic, and this measures the pressure inside your arteries when your heart is pumping blood out to the rest of the body. The bottom number is called the diastolic. This measures the pressure when your heart is relaxing. The normal blood pressure is 120 over 80. Now there's quite a bit of wiggle room, and not everybody will have a 120 over 80. Somebody can have 125 over 82, 128 over 80. So there is some wiggle room. So it's not specific that everybody needs to have a blood pressure of 120 over 80. But we don't want it to be too low because that means the heart is going to struggle to pump the blood around the body. And also we don't want it too high because then we call that high blood pressure, and then we're going to have all the problems and complications that come with high blood pressure. So what are the numbers that indicate that you have high blood pressure? Now, firstly, it's really important to know that our blood pressure varies throughout the day. It varies with activity, it varies when we sleep. So for example, if you're running and you check your blood pressure, it's going to be high. So for us to diagnose somebody as having high blood pressure, we usually say that someone has to have their blood pressure over a certain number over a certain number of days. So it has to be persistently high. We just don't want to take one reading today and say you have high blood pressure. No. There are circumstances where we might diagnose somebody as having high blood pressure, in particular if their blood pressure is really, really high, and we need to give you medication immediately to lower it down. So taking into account what I've said, we will diagnose somebody as having high blood pressure if there's two scenarios. So one, if you do it at home over a certain number of days and your average is 135 over 85 and above, then we say you have high blood pressure. If we did this in clinic or in a hospital setting, then that number will have a little bit more wiggle room. So we will say if your blood pressure is 140 over 90 and above, then you have high blood pressure. Why is there a difference? Well, mostly because when you're at home, we expect that you're more likely to be in a relaxed, familiar environment, as opposed to when you're in clinic or when you come to the GP or you go to see the doctors or wherever you go to get your blood pressure taken. There's a chance you might be a little bit more anxious because, again, being a bit stressed or being anxious can increase your blood pressure. So that's why there is a little bit of wiggle room. But again, we look at the average. So I've got a video coming up which is going to show you just step by step how you can measure your blood pressure at home and how you come to the conclusion of what is your average blood pressure if you've done it at home. So why do we worry about high blood pressure? Why do we talk so much about it? Because high blood pressure increases your risk of getting things like heart attacks, getting strokes, And we worry about these things because one, they can lead to death. Two, they can cause significant problems with your health in the long term. So the other thing is high blood pressure can cause damage to your heart. So it can lead to things like heart failure. High blood pressure can also increase your risk of getting things like dementia, like kidney problems. So what are some of the symptoms that might indicate that you have high blood pressure? First symptom is that most people have no symptom at all. So a lot of people with high blood pressure will not know that they have high blood pressure. And that's why it's really important that we talk about it. And statistics suggest that 1 in 4 adults have high blood pressure. So that's quite a lot of us. So what are some of the symptoms that might indicate you have high blood pressure? So headaches is a common one. Blurred vision, dizziness. Now bear in mind that all of these symptoms do not mean that you've got high blood pressure. They're just some of the symptoms of a high blood pressure, but they might mean something else. So it's really important, if you have any of these symptoms, that you seek medical advice. So what causes high blood pressure? So there are 2 types of high blood pressure. So we call the first one primary hypertension and the second one secondary hypertension. The majority of people have primary hypertension. So approximately 90% of people have primary hypertension and the rest have secondary. So secondary hypertension is where we know the exact cause of that high blood pressure. It might be due to kidney problems, endocrine problems, pregnancy, things like that. Whereas primary hypertension, that is where it's due to multiple factors, where we can't exactly pin it down to one thing, but we know that there are multiple contributing factors. So who is at risk of getting high blood pressure? So we have 2 categories. So there's one category which are non-modifiable risk factors. So there's nothing you can do to change that. So for example, your age. The older we get, the more likely we are to have high blood pressure. Ethnicity. People of Black, African or Black Caribbean origin are more likely to have high blood pressure. The other one is genetics. So if anyone in your family has high blood pressure, for example, your mother or your father, then that increases your risk of getting high blood pressure. Now, the other group is the modifiable risk factors. So this is why we talk so much about this, because we know that there's so much that one can do, there's so much that we can do together to work on these parts so that we reduce your risk of getting high blood pressure, and at the same time reduce your risk of getting other health conditions as well. So if you're overweight, if you don't exercise, if you eat a lot of salt, if you smoke, drink a lot of alcohol, if you have a lot of caffeine, all of these things can increase your risk of having high blood pressure. So how do we treat high blood pressure? So there's 2 forms of treatment. So there's lifestyle changes and there's medication. I'll talk in more depth about these 2 forms of treatment in another video, but the lifestyle changes are looking at those modifiable risk factors that we talked about. So everybody diagnosed with high blood pressure, we will need to discuss the lifestyle changes. So that's everyone. Not everybody needs medication. So medication is added on some people depending on what their blood pressure is. So what are these lifestyle changes? So that is making sure that your weight is a recommended weight for your age, your height, your sex. So making sure that your BMI is what we would want it to be. Making sure that you are not drinking too much alcohol. Making sure that you're taking enough salt and not taking too much salt. Making sure that you're exercising throughout the week if you're able to, cutting down on things like caffeine, managing your stress levels depending on, what's causing your stress, and really looking into that. But there's so much that can be done, and that is treatment for high blood pressure, and that itself can significantly lower your blood pressure. So it's really important to know that there's so much you can do and there's so much we can do to help you to reduce your risk of getting high blood pressure. And if you already have high blood pressure, there's so much you can do and there's so much we can do to reduce your blood pressure. And then some people need medication, and then we can add medication on top of that. I hope you found this video useful and informative. Thank you so much for watching. If you haven't subscribed, please make sure you subscribe. Please do share this video to other people. Stay tuned because I have so many more videos on blood pressure itself and other health topics coming up. Thank you so much. Bye. And let's not forget stopping smoking.